The more information I had, the better it made me feel, because it's always the unknown that gets to you more than anything else. Once you know what you need to deal with, it makes life a little easier.
The PET scan looks at the function of the body, whereas other imaging modalities look more at the anatomy. So it just gives different information for the doctors to manage a patient's condition.
I was told by my specialist that I would need a PET scan, and I was then notified as to my appointment by telephone. They gave me a brief insight into what I would need to do and what I was not to wear and things like that. Primarily not to eat for 6 hours beforehand, just have water if I needed anything. And they were very good. They in fact put me at ease. Obviously when you're coming in to have something new, you're always a little bit anxious. And once I'd had my mind put at ease that, you know, the radiation wasn't going to be a problem, I was okay.
The tracer that we inject is similar to glucose. So basically we're injecting the patients with a radioactive sugar, and we want their blood sugar as low as possible. So we instruct them to fast for 6 hours prior to the scan and only have water to drink. If patients are diabetic, if they're controlled by diet or oral medications such as metformin or glycoside, then they carry on their normal fasting for 6 hours. If they're on medication, then we instruct them to take that first thing in the morning. If the patient's insulin dependent, so we try and organise their scans for sort of mid to late morning and instruct them to have a light breakfast in the morning and to take their insulin as well. We also instruct patients not to chew gum, one because it contains sugar, and also because you're using the muscles in your jaw, you can get increased uptake of the radioactive tracer in the muscles around the jaw. If the patient's eaten and their blood sugar's higher, then we get a poor quality scan, which is difficult for the doctors to read.
But I had been informed by the telephone call where approximately to go within the hospital. And you also have a map enclosed which shows you the various departments. I then went to the specialist department for PET scans. I saw the receptionist. They ask you either if you have your letter with you, which is a good idea to bring your letter along because it has your hospital number and everything on it. And they will ask you to confirm your name, your address, and also your date of birth. So therefore you know that you're going in for the right procedure.
The first things we do is measure the patient's height and weight, which is important, one, for working out the amount of radioactive tracer that we need to give the patient, and we use the height as part of the basis of the scan. We also check when the last time they ate and whether they're diabetic and if they've taken their diabetic medication. We then take the patient through to injection area where they go into an uptake bay, which is where they're going to stay while the tracer is taken up by the body for an hour and a half.
The cannula is fitted into your arm so that you don't have to have multiple injections. The first time it could be a little daunting, but it is literally just a tube that's inserted into the arm via a needle. It's then attached with tape, and therefore they can then administer what medicines they need to give you through that cannula.
We measure the patient's blood sugar levels and make a note of that. Then we draw up the radioactive tracer dependent on the patient's weight with another radiographer, which is double checked. And then we inject the tracer.
The procedure was talked through. When serum was brought in, he told me what he was going to do. Then he got the little file out of a special box, which is a little bit daunting. And then I was administered with the radioactive serum.
Once we've done the tracer, because we've made them radioactive, we as staff tend to keep our distance from the patient, but we are within communicable range for them to contact us if need to be. They sit quietly in the uptake room for an hour and a half. We don't want them to walk around too much. They can walk to the toilet, that's fine. Otherwise we get uptake in the muscles. They can read. We have DVD players that they can watch. They can bring music with them, or they can go to sleep if they want to. We give the patients water to drink just to help flush the tracer through the system. With any radiation, there is an inherent risk from it, but we carry out scans on the basis of weighing the benefits against the risk. If it's a benefit to the patient, then and the clinicians deem it necessary, then we'll go ahead with the scan. The dose to the patient is equivalent to 5 years background radiation. There's no side effects from the tracers, so the patients won't feel any different, or they may feel it's a little bit cold as it goes up the arm.
A lot of the time I just used to try and relax and think of nice things in my own mind to relax me before I went in to have it done.
10 minutes before the scan, we'll get the patient to empty their bladder one last time. If they do need to, we'll put them into a gown if necessary to remove any metal artefacts. A metal blocks part of the scan.
I would come in with elasticated trousers, and of course if you wear bras with metal in, you have to take those off as well. They are able to accommodate you if you come in jeans or whatever with the gown.
So we take the patients through to the scan. The patients lie on their back with their head towards the scanner generally.
They will then lay you down and make sure that you're comfortable, and you have to obviously keep as still as you can, and you also have to have your arms up above your head, which I found a little bit uncomfortable at first. I found the easiest solution and way to do that was to cross the wrists, one hand under the other, rather than clench your fingers together.
There's no noise from the scanner itself. There is a background hum due to fans in the machine, but there's nothing else. The patients don't feel anything during the scan. All they notice is the table moving at various points. There's a microphone situated in the scanner, so if they need to contact us, they can call us and we can speak to them if they need to. We have a camera that also concentrates on them so we can see them as well as hear them.
The radiographer will be there with you at the beginning. They go out of the room and they're talking to you via a separate office, and you will be put in gradually, and they will take several shots of different parts of the body. You can be in there anything from 20 minutes to 40 minutes, really depending on the areas that need to be looked at.
So after the scan's finished and we've made sure we've got all the pictures we require, we get the patient off the table and they're instructed that they can eat and drink as they would normally, but they need to keep their distance from children, anyone that's pregnant, for 6 hours after the injection. And we give them an instruction sheet to take away with them with that information on. Radioactivity is decaying all the time, but there's still a small amount left in the body. So just to reduce the risk to children and anyone that's pregnant in that time.
When you come out of the scanner, you'll still have your cannula in. They will be doing no more work on you at all, other than the fact that you will go back, you'll be asked to wait for 20 minutes, and then they will come and take the cannula out of your arm. They will dress your arm. They will ask you to wait around the hospital for approximately 30 minutes. That's just in case the arm starts to bleed, or you may feel a little bit nauseous. But I've never had any experiences like that, so it is just purely precaution. Also, a good bit of advice is to drink plenty as well, because that will help to flush it through.
So for male patients, we instruct that they sit down to urinate, and we instruct the patients to flush the toilet twice, just to remove any radioactive traces in the toilets. There's a lot of information produced from the scans, and we have two consultants that look at the scans. So one will report initially, and the second one will check that scan the day later.
I think I had to wait no longer than 10 days, but knowing the amount of people that had to look at these scans in order to get the right diagnosis, I was quite happy to do that.
The more information that the doctors get, the better the diagnosis is for the patient and help to manage their condition better.
I think if you're invited to have a PET scan by your specialist, ideally just try and take it as another part of your treatment, and they will get a better diagnosis through it. Sometimes people don't really want to know what's going on, but I always like to know firsthand what is there, and then what do they plan to do about it.